So leg vein treatments are time consuming. And we used a different laser in the past called the VersaPulse, which was a green light laser. Now we're using the pulse dye, the advantage being, well, there didn't exist a pulse dye that could give you a real 40 millisecond, 50 millisecond pulse duration. We'll use the pulse dye, get rid of some of these veins. You don't mind being a little pink and puffy, right?
No, not at all. There's a price for beauty.
That's it. You can hear the laser makes a different sound when it's on the 40 millisecond pulse width. The old laser had 4 subpulses creating the pulse. So they had 4 subpulses creating the pulse, and it wasn't enough. It didn't behave like a true long pulse. The new laser has 8, and it really functions like a true long pulse laser. Right where this green light is, right here. See that vein? Watch. See ya. Let's do these little pink ones here. Don't you hate people like this? You look, you're like, oh, these horrible veins. Makes you feel bad about yourself.
That's because the laser's so good. It's taking care of all the issues.
She's got like 2 veins ever. When you inject the larger veins with sclerotherapy, it's a solution that irritates the vein, either a solution like saline that's real concentrated, salt water, or an irritant like a detergent that will irritate the lining of the veins. You inject it, looks like the vein disappears just because the blood gets pushed out and water takes its place, basically, which is clear. It's like, ooh. But then immediately the vein refills and it looks irritated. And what we're doing here is we're irritating the vein just with light. The light that's preferentially taken up by the hemoglobin heats the vein. And it'll disappear too, because the heat pushes the blood out. This little brown pigment. You have a couple little spots, which could be post-treatment hyperpigmentation, brown spots, from laser.
It goes away with time, though.
It always goes away. It's like a massage.
I was going to say, the sclerotherapy was so painful. This is like nothing. It just feels like cool blasts of air. Like the ankle area is a little sensitive, so that I feel more.
Most people find it pretty uncomfortable. I mean, it's very variable, but people think this hurts. I don't know if are you disguising?
No.
It really doesn't bother you that
thing that I sometimes feel is the ankle, like my left ankle. But
you can get a bruise if you get a bruise. It always goes away. It can last 4 to 7 days. The biggest side effect is hives, as you know. You get a little bit puffy. Usually lasts part of a day, but can last longer. Puff out your cheeks for me. People get veins here and here that are hereditary. All the rest, that's good, are from the sun. You had a bunch of them here, actually.
Were mine hereditary?
These are, yeah. These are, and these are, but these are from the sun. So you got it going on. You're good.
Yay.
You are done. And these did well. Take a look. See little hive reaction
Thank you.
around where the veins were? See these little tiny hives? That's the reaction you expect. And look at this one. See, you can see the outline. And if you had sclerotherapy there, you get the same result. Irritates the vein. First, it looks like it's gone. Then the blood comes back in, it's irritated. And that's what we want, is to irritate the vein. High five, you did well. Who's the man?
You are.
See?